Okay, good evening, everyone, and welcome to the Dayton VA Medical Center See What You're Missing webinar. We are thrilled to have so many participants on today's session. I want to start by saying this evening is being recorded, so if there's something you missed or later want to rewatch, you'll be able to do that. We'll be sending you a link to this recording after the event. You can also share that link with anyone you feel may benefit from the information we're sharing tonight. I'm Scott Leese with the Community Outreach Office at the Medical Center. I'm an Air Force veteran, and like many of you, once had many questions about VA healthcare. Let's see if we can answer your questions this evening. Please realize that as a participant in this session, your microphone has been muted to minimize distracting background noises. We have quite a few participants on this webinar, which is why we're keeping everyone muted. Again, this is simply to ensure that there isn't any excess and distractive noises. That doesn't mean we don't want to hear from you. If you have a question or concern, you can share it with the panelists anytime through the chat pane. You should be able to find this pane on the bottom right of your screen. Simply type in your question, and one of the presenters will get to you as soon as they can. For the sake of time, if we don't get to your question during this presentation, you can reach us by phone or email, and we'll provide that contact information at the end of the presentation. Now I would like to take a few minutes to have our director, Mr. Mark Murdoch, introduce you to the Dayton VA Medical Center.
Hi, I'm Mark Murdoch, Air Force veteran and director of the Dayton VA Medical Center. I'd like to welcome you to the Dayton VA, one of the largest and most historic veteran medical centers in the nation. This campus began as a soldier's home in 1867, providing medical services and rehabilitation to Civil War soldiers. Though the campus has changed over the years, our purpose has not. Just as President Lincoln instructed all those years ago, our mission remains to care for him or her who shall have borne the battle. We do this by putting you, the veteran, at the very center of every decision we make. Whether it's the revitalization of our historic grotto and the healing gardens, the addition of a new MRI suite and simulation center, our community-based outpatient clinics, which were designed from the ground up with our veterans' needs in mind, our complimentary valet parking for our veterans, or the construction of a new Fisher House to give you and your loved ones the ability to rest and recover with all of the comforts of home. Your physical, mental, spiritual, and emotional needs are at the heart of every step that we take. Here at the Dayton VA, we carefully balance our historic significance as one of the first centers for veteran health with the medical needs of the veterans of today and tomorrow. We are proud of our more than 150 years of dedicated service to those who gave us the freedoms we enjoy today, and look forward to spending the next 150 years continuing on the path President Lincoln laid out before us. Thank you for coming to the Dayton VA Medical Center, where we are honored to provide the best possible care to our nation's heroes. You served us, now let us serve you.
Mr. Murdoch, well, we have a long history of veteran care here in Dayton. This year marks the 75th anniversary of the modern Veterans Administration. We're proud not only to be one of the oldest campuses in the VA, but also boast one of the newest and most modern medical facilities offering top quality care. Not very many people know that the VA is recognized, according to a study done by RAND, as being one of the top medical care systems in the nation. And it's top rated by the vets who it serves with more than 98% satisfaction rating. That is a benefit that not everyone is able to receive. This is a benefit that's only available to veterans. Wouldn't you like that kind of care? Well, we hope so. And well, that's one of the reasons why we're here tonight. For those of you who are not enrolled with the VA, we hope you take the opportunity to do so now. It's easy. One way is to visit the Dayton VA Medical Center and stop by the Enrollment and Eligibility Office. They will be glad to help you, walk you through the process. You may want to call first to schedule an appointment. That number is 937-268-6511, extension 336. Again, 937-268-651-5336. They will tell you what documents you will need to bring with you to determine your eligibility. For the tech savvy, you may want to enroll at www.va.gov. Veterans may also reach the National Call Center to apply at 877-222-8387. And finally, veterans may mail in an application directly to the Dayton VA Medical Center or drop that application off personally. You can also enroll in person at the surrounding community-based outpatient clinics, also known as CBOCs. They're located in Lima, Middletown, Richmond, Springfield. We'll share detailed contact information and phone numbers again at the end of the presentation. Now, the reason we're here tonight, let's hear from someone who can tell us more about how veterans can receive an often vital benefit of VA healthcare, their eye care. Dr. Julie Statz, Chief of the Optometry Clinic for the Dayton VA Medical Center, is going to tell us how veterans can receive vision care. Take it away, Dr. Statz.
Which choice looks clearer? Choice number 1 or choice number 2? Now which is the clearer choice? Number 1 or number 2? If you've ever had your eyes examined, you likely remember the doctor asking which lens choice allows you to see more clearly. Frankly, sometimes those choices look very similar. Luckily, when veterans need to choose where to go for their eye care, the choice is much easier and very clear. The Dayton VA Optometry Clinics.
Hello, I am Dr. Julie Statz, Chief of the Optometry Services at the Dayton VA Medical Center. So what makes the VA Optometry Clinic the clear choice for veterans seeking eye care? Convenient locations, highly trained staff, state-of-the-art equipment. Our focus is on your needs. Our convenient location, highly trained staff, and state-of-the-art equipment all make the list. But what really sets us apart is the focus on the unique individual needs of each veteran we serve. Having a routine eye exam is just as important as having a routine physical. That's why we have an optometry clinic located in the main patient tower of the Dayton VA Medical Center and in each of our community-based outpatient clinics. Just let us know if an appointment in Lima, Middletown, Richmond, or Springfield is convenient for you. All our current staff optometrists are residency trained, which means that they all have completed additional advanced training after graduating with a Doctor of Optometry degree. You can be confident that your optometrist has been trained at the highest level to provide you with advanced diagnostic and therapeutic care. In addition, the Dayton VA Medical Center, in association with the Ohio State University College of Optometry, has an accredited ocular disease residency program where we teach and train graduated doctors to practice at the same high level of care that we provide daily. No matter which Dayton VA location you choose, you will receive the most comprehensive vision care and ocular health exam with up-to-date equipment. Recent advances in technology allow us to detect, treat, and manage ocular conditions earlier and more effectively than ever before. Let's take a closer look at some of the common conditions that we see. You probably know at least one friend or family member who has had a cataract removed from their eye. A cataract is a clouding that develops within the lens inside your eye and is natural to the aging process as getting gray hair. Over time, your vision may become blurry, like looking through a dirty window, making it difficult to read, watch TV, or drive at night. You may also experience problems with glare or halos around lights. New glasses may improve your symptoms, but when they don't, your optometrist will work with you to determine if the time is right to consider a surgical referral to our ophthalmology service. Did you know that patients who have early glaucoma don't have any symptoms? Glaucoma is a condition that damages the optic nerve, the delicate cable that transmits what you see to the brain. Over time, this damage leads to a loss of peripheral vision that progressively worsens until the central vision is affected too. Early detection is key to reducing the risk of vision loss. Your optometrist will evaluate your eyes thoroughly for signs of glaucoma by measuring the pressure inside your eye and by using special equipment to measure the health of your optic nerves. Most glaucoma cases are treated with special eye drops to help lower your eye pressure, but in some cases, a surgical procedure may be required. Maintaining excellent peripheral vision is very important, especially to those who wish to maintain a valid driver's license. Macular degeneration and diabetic retinopathy are just two of the many other conditions that can affect your vision by damaging the retina, the thin tissue layer in the back of your eye where a visual image is formed. Since both of these conditions are leading causes of blindness, early detection and intervention is critically important. Again, there are often no symptoms. With early clinical changes, it's important to get routine exams. They are vital when you are at risk. Your optometrist will use special eye drops to dilate your pupils, which allows for a more thorough exam of your retina. Now back to what really sets us apart, our focus on the unique needs of each veteran that we serve. Many of our patients rely on eyeglasses in order to see clearly. Your doctor will evaluate your vision and carefully measure your eyes to determine the best prescription for you. Eyeglasses are just another benefit to choosing to receive your eye care through the VA. Imagine zero additional out-of-pocket expense for standard eyeglass lenses and frames. If desired, upgrades to premium lenses are available for purchase. In some cases where eyeglasses alone do not provide the vision that a patient needs to perform their daily activities, eye muscle training or visual aids that provide extra magnification may be required. When indicated, our optometrists coordinate with our advanced low vision clinic to provide these services. Likewise, some of our patients have ocular conditions that can only be treated with special medically necessary contact lenses, which are available from our contact lens clinic. In addition to determining the best prescription for you, your doctor will also take the time to make sure your eyes are healthy enough to continue to provide you clear vision throughout your lifetime. Using advanced diagnostic instruments, you will be evaluated for ocular diseases, ocular side effects from any medication that you may take, and adverse effects from systemic diseases like high blood pressure, diabetes, heart disease, and stroke. Our clinicians are equipped to diagnose and treat and manage most eye conditions. If you need surgical or specialty eye care, we work closely with the ophthalmology clinic to get you the right specialist at the right time. The first step to taking advantage of the many services that we have to offer is to enroll in the VA. Every enrolled veteran has direct access to schedule an appointment in the optometry clinic at their convenience. No referral is needed. Whether you need a routine exam, ongoing treatment of a chronic condition, or an urgent evaluation for sudden vision loss, double vision, floaters and flashes of light, a red eye, or even a metal particle in your eye, we're here to take care of you when you need us. Call us directly at your preferred location to schedule an appointment or to discuss your needs. In the Dayton VA Optometry Clinics, our mission is to provide comprehensive and state-of-the-art eye care to our veterans with highly trained doctors and technicians. We are proud to do so at our main Dayton VA campus and at our outpatient clinics in Lima, Middletown, Richmond, and Springfield. We believe that ultimately what sets us apart, what makes us the clear choice for veterans, is that our focus is on you and your individual needs. No matter the concern, we are uniquely qualified to give you the very best in comprehensive eye care. We look forward to seeing you soon.
Wow, that was a great presentation, Dr. Stats. Now we're going to take some time to answer questions we received through the chat pane. We've received a few already, but please remember, if you have a question, feel free to ask it by typing it into the chat pane. We'll get to it as soon as we can within the time remaining. If we don't get to your question, please know we still want to answer it. We will give you a way to contact us at the end of this presentation. We have with us live this evening Dr. Julie Statz, Chief of our Optometry Clinic. She started with the Dayton VA as an optometry student in 2004, then completed her residency at the Dayton VA in 2005, went on to work as a free basis provider, CBOC staff provider, residency coordinator, and now is Chief of the Optometry Clinic. Also with us is Dr. Elizabeth Libby Lemons. She is staff optometrist and residency coordinator. She started at the Dayton VA with a residency in 2018-19. Her staff position began on completion of her residency in 2019. And also in the room is Dr. Dayla Casey, who is staff optometrist. She started at the Cleveland VA with a student rotation, then completed a residency at the Columbus VA in 2020. She has been a staff provider at the Dayton VA since July 2020. And finally, we have with us Dr. Rebecca Diller, who is our staff optometrist residency coordinator. She completed a residency at the Columbus and Chillicothe VA MC, that's VA Medical Center, and has been a staff optometrist at the Dayton VA since October 2000. Again, I'm Scott Leese with the Medical Center's Community Outreach Office. I'm an Air Force veteran and will help answer any questions you might have about the Dayton VA Medical Center in general. Now, let's see what questions you have and how we may answer them. First of all, Joseph wants to know what COVID-19 restrictions are in place at the Dayton VA Medical Center. Joseph, right now we are saying that everybody has to wear a mask. If you are not feeling well, we ask that you identify immediately. We can actually do COVID testing, but there is a mask mandate right now. And we also have restriction on allowing children into the facility. You can find out all the details about what the COVID policies are and visitation policies are on our website at www.dayton.gov. David wants to know, what about LASIK surgery? And Dr. Statz, I think you're trying to answer, and we've got you on mute. Let me unmute you real quick. There
can you hear me now? Okay.
Yes, we sure can.
So I'll take that. LASIK surgery is considered to be cosmetic by most insurance companies. And so the VA does medically necessary procedures here at the VA. And so LASIK is not something that we provide here at the Dayton VA or any VA.
Okay, William wants to know, what are the yearly exam eyeglass benefits? What about contact lenses?
So I think that's a two-part, but I can touch on that. So for the eyeglasses, what makes a veteran eligible for glasses is if there's a change in his glasses prescription, his or her glasses prescription, or if the current pair of glasses is broken, lost, out of sorts, kind of scratched up. And so it's not necessarily on the dot year by year, but as a as needed basis when it's time to update. As far as contact lenses, we have a medically necessary contact lens clinic, which means that if you've had an eye surgery or eye disease that requires contacts to see your best vision, those are the veterans that we're able to fit into contact lenses.
All right, super. Thank you for the answer. Chuck wants to know, do you only have the military birth control glasses, or are there other options?
No, so one of the things on the video you got to see was that there's a whole selection of frames that are considered standard frames through the VA optical and through our prosthetics department. So we have more than the old-fashioned birth control black plastic frames. There's a nice selection, actually. We recently updated our optical shop vendor, and so we have a new selection of frames since October of last year. So it's been about 10 months. And so there's a whole slew of frames that are considered standard and are at no cost to the veteran if they qualify for the glasses.
Terrific. Jack wants to know, must I wear a mask in the building even though I've been vaccinated? Yes, Jack. Again, we have that mask mandate, and that is for your protection as well as other folks' protection. You can, again, find that information on our website at www.dayton.gov. Additionally, you can also find information about vaccinations for COVID-19 there as well. Jonathan says, I almost failed the driver's test with glasses on. And soon after I had an exam at the Youngstown VA clinic, I was told I have no issues with my eyes. Would you recommend Dayton? I'm 100% service connected.
It's not uncommon that we encounter veterans who maybe had difficulty passing a driver's test, and there's more than just having the right glasses or the wrong glasses. Things like dry eye can impact your ability to pass the test. And sometimes it's just kind of a fluke that, something was off the day you went in for that test, and you struggled with it a little bit. And I'm not proud to say I experienced that not too long ago myself. So, sometimes if your eyes are dry and you're not blinking, you may struggle to read those letters. I certainly wouldn't say that, if someone made a mistake or you had poor care if you had difficulty passing that test. But I would encourage you to get rechecked, because it may be something beyond just glasses that was causing the problem, such as dryness or something else, cataract formation, whatnot. So, vision, 20/20 vision goes well beyond a prescription pair of glasses. There's many other things that can cause that. So, if you struggled, certainly that warrants a recheck or another exam to see if there's something other than just that glasses prescription that was causing the issue.
Terrific. Thank you for that answer. Chris wants to know, can I get contact lenses and supplies through the VA?
So I'll kind of take this in again, since I touched a little bit on it before. So it does depend on your eye history. And so establishing with a routine eye exam would be the first step. And then we'll be able to answer that on a more individual basis. Again, it's typically certain eye diseases or eye surgeries that limit your ability to see well with glasses. If we determine that you're eligible, then the VA does take care of those services for you.
Okay, thank you, Libby. Jackie wants to know, does the VA have a means to treat macular degeneration? What treatments are there?
Yes, so there are two forms of macular degeneration. There's the dry form and the wet form. The wet form being the more serious form, but it's also the treatable form of macular degeneration. So if you have the dry form, you're typically monitored in the optometry clinic. We have some pretty sophisticated machines that we can use to monitor for macular degeneration, and more importantly, to monitor for that conversion to the more serious form. When you have the dry form, really there's no treatment per se other than careful monitoring. There are eye vitamins that are available. There was a rather large study that shows that a kind of certain mix of vitamins may help slow the progression of moderate macular degeneration. If you have the wet macular degeneration, which is the more severe form, we would refer you to our ophthalmology clinics, more specifically our retina specialists, and they're able to treat macular degeneration that has progressed to the wet form. And so that would either be most likely with eye medicines that are injected into the eye, sometimes lasers, but that would be the decision of the ophthalmologist, and it would depend on, what type or, how that macular degeneration presents. So.
Okay, thank you, Rebecca. Earl says, I'm severely poor-sighted and need assistance finding my way sometimes. I take a taxi or a bus if somebody can, will they help me or assist me finding my way through the medical center to my appointment and then back to my transportation? I think I can probably help answer that. We have an escort service here that actually will meet you at the front door. You can call them at extension 2280 or 1285. Or even just showing up at the front desk, there will be somebody who can help you find your way. Tom wants to know, what is the average time for healing after cataract surgery? I have a limited time, and I can't take much time off from my job, and need to know if I will have enough time for recover from surgery before I can go back to work.
So it's going to kind of depend patient by patient. So typically you want to plan the first week to kind of take it a little easy. The first week you're going to have some physical restrictions, so you really don't want to be heavy lifting. You don't want to bend at the waist. So if you have some work requirements such as that, maybe might hold off for a few days on that. But you'd want to kind of make necessary arrangements for work and other activities during that time, just to allow you to kind of heal.
Terrific. Thank you, Dahlia. Christopher says, I came in about 10 minutes behind starting time. What percentage do we need to be to receive vision benefits? And I'm sure by that he means what percentage disability.
So here at the VA, you simply need to be enrolled in the VA. If you are eligible for care through the VA, you are eligible for an optometry appointment and an exam to determine whether you qualify for our glasses, contact lenses, low vision, any other services that we might offer through the eye clinic. But the big thing is, are you eligible to enroll in the VA? And if you're eligible to enroll in the VA, then you're eligible for the optometry clinic. Some of our patients do have a copay depending on their income levels and that sort of thing. But again, that doesn't necessarily change whether you're eligible or not, just changes maybe whether or not you may have a copay for the services.
Right. Okay. Thank you, Dr. Stats. William says, as a newly separated and newly enrolled, do we bring current prescription glasses with us? A couple of years old and not sure they are still accurate. So I think he's probably looking for evaluation on his prescription.
Yeah, no, that's a great question. We definitely recommend that you bring your old glasses with you. Sometimes the prescription that we find looks like it may be a little bit difficult to adapt to, or we may need to modify the prescription. Eyeglass prescription is somewhat of an art, and so making sure that we design the right prescription for you takes a lot of different pieces of information into account. And so having the old pair of glasses is very helpful for us to kind of know what you've been wearing, what your vision with those glasses are, and then the prescription change that we're getting, does it make sense? Is it going to help you see better? That kind of thing. So always I would bring the prescription and or the glasses with you to the exam, just so that we can kind of have a starting point. If you don't have them, we can certainly do it without, but it's always nice to have another piece of the puzzle to put things together.
Terrific. Okay, so Christopher says, I have dry eyes and keratoconus, and I hope I pronounced that right. Does the VA help with gas permeable contact lenses for keratoconus disease? And I know I didn't pronounce it right there.
Since I'm on a contact lens kick, I can address that. So keratoconus is one of the eye conditions that would qualify you for medically necessary contact lenses. And so if that is something that you've been diagnosed with, that would be something that would justify for sure gas permeable or specialty contact lenses.
Okay, super. Thank you. Greg wants to know, does the VA provide work safety glasses?
Yes. We have a smaller selection of frames that are safety frames, but we do have frames for veterans who need that for employment reasons. And so we do have that option, and we also have the lenses that are polycarbonate or more shatter resistant that would go in those safety frames. So that is an option through the VA.
All right, terrific. Pardon the little technical difficulty here. I'm trying to get through the chat box. Does the VA provide work safety glasses? We answered that one. How often should a diabetic get their eyes checked?
We recommend yearly exams for some diabetics. Other diabetics may be every 2 years, and that just depends on multiple things. The biggest thing being if we see any evidence of diabetic changes, even if it's the most minute, small changes, we recommend at least yearly eye exams. If we have a veteran who's well controlled and we don't see any evidence of diabetic retinopathy, we will oftentimes use our teleretinal program. We're fortunate in the VA system and in our C-box to have teleretinal cameras, which allow the veteran to come in maybe to the prime care clinic or the C-box clinic and have photos taken of the back of the eye. Those photos go to a reader in various VAs who will review those images and look for diabetic retinopathy. And all those readers have gone through some very extensive training for that. So I guess the short answer is yearly, but that may vary whether it's a yearly picture of the eye or a yearly diabetic eye exam. And so we don't do, consecutive years of pictures. We would alternate every other with the pictures and the dilated exam. But again, that just depends, if there's anything present and how the control is, and if there's other things within the veteran's eye that we need to monitor, such as glaucoma or cataracts and things like that. So.
Okay, thank you, Rebecca. Again, a reminder, if anyone has any questions, feel free to type that into the chat pane or the Q&A pane. We'll be glad to answer any questions you might have. Keep in mind that if you have a question, probably somebody else has a very similar question, so do not be shy about asking those questions. We've had some great ones so far. Another one we have is from Alice. Alice would like to know, can I bring a service animal with me to the medical center? Yes, Alice, you certainly may. We understand completely the need for some folks to bring a service animal. We only ask that they are actually certified service animals and are identified as such. Butch is asking, how much does it cost for a new set of frames?
So the standard frames that the VA has to offer are at no cost to the veteran. Also standard lenses, which are determined based on the prescription or the individual's needs or disease process that might be going on in the eye. If you would like to upgrade to things like transitions where the lenses darken when you go outside, or an anti-reflective coating, or specialty lenses that are thinner, you can always upgrade to premium lenses, and those are at the veteran cost. And those vary. So it really depends on what additions you're looking to upgrade to. But if it's just a standard lens, including bifocal, no line, single vision glasses for distance or reading, those are all covered by the VA and would not cost the veteran anything.
Okay, Christopher would like to know, if I have an ophthalmologist, will VA assist me to receive care through that office?
You may be talking about our community care program. We have services through the VA and our ophthalmology department that are covered here in-house. So if it is a particular type, it depends on what you're treated for and how you're treated for that. If it is something that we cover and do here in the VA, then we send that information. We would take that information from your outside provider if you provided us the exam notes. We would take that, send that on to our ophthalmology department. They would determine whether or not that's something that we provide here. If it's something that we provide here and we can see you within a timely manner, then you would have your care here through the VA. If we don't provide the service, or if we cannot see you in a certain period of time, which for specialty clinics is 28 days from the indicated date. If that's the case, then you would be eligible for community care. And if the provider that you're seeing is a community care provider, then, you know, the VA would authorize you to be seen through our community care program. But it does depend, and it really does depend on what it is that you are needing to have the exam for and how quickly we need to see you for it.
Terrific. Thanks for that wonderful answer. It appears that we don't have any other questions in the queue right now. So I think we could probably go ahead and wrap up, though I will tell everyone that's still on with us that if you have a question, it might be a personal question that you don't care to share with everyone. We're going to give you some contact information, how to reach us. If I have accidentally skipped your question, we will find out what we missed here, and we'll reach out to you. But if we don't, again, call us with any questions you might have. So we're going to go ahead and wrap up this evening's session if we don't have any other questions, and it appears that we don't. So again, if we didn't get to your question, not to worry. You can call us at 937-268-6511 at extension 2035 or 2159. Again, that number is 937-268-6511, extension 2035 or 2159. Or you can call our eligibility and enrollment office if you have any questions, and their number is 937-268-6511, extension 4105. That's for any questions you might have about enrollment with the Dayton VA. Again, that number is 937-268-6511, extension 4105. Again, there are several options for enrolling with the Dayton VA Medical Center. If you're not currently enrolled but would like to enroll with the Dayton VA, here's how you can do it. First, in person. Second, online. Third, call our call center, our national call center, or mail in your application. We can also enroll you at the surrounding community-based outpatient clinics, also known as CBOCs. They're located at Lima, Middletown, Richmond, Springfield. You can see their phone numbers there on the screen. And again, feel free to reach out to them. They're there for your convenience at a convenient location near you. And we hope we've answered your questions about eye care. And hopefully we now know a little bit more about what treatments are available through the VA and in general, and are ready to enroll. So I just want to say thanks again for attending this event. Thanks to our wonderful panelists. You've done a terrific job, and have a great rest of your evening, everyone. And thank you, veterans, for your service.